questions I've been asked to answer are: what does the leadership at Washington Hospital attribute the success of lean management to, and what makes it work? So I'm going to answer that first. The leadership at Washington Hospital attributes their success of implementing lean management to the change in focus and process of improving the organization. Lean management has been used in healthcare for about 15 years and has two main principles: continuous improvement and respect for people. What it does, it brings all the levels of staff together to work on one common problem and come up with solutions together. It's the staff who are actually doing the work and using the systems that come up with the ideas of improvement. I think that their cooperation and involvement in improving the organization as a whole for them and for their patients is one of the biggest factors in the success of this management style. In addition, the willingness of upper management and staff, such as executives and physicians, to be open to the input from the lower staff and applying it is a huge factor in their success of implementing the lean management system as well. Their goal in implementing the system as a whole is to focus on the patient perspective and improve processes by eliminating waste or activities that don't add any value. By adopting the lean management system, Washington Hospital has been able to run a high quality system that can still keep costs down, but keeps their patient first ethic at the forefront. The second question was, how does leadership know that lean management is working at Washington Hospital? So, in my opinion, and really based off the commentaries of those who were interviewed in the hospital, the result of success of the lean management system is really reflected in the improvements seen after they implemented a new process or change or idea. So for example, from the staff perspective and opinion, the lean management system has improved nurse access to frequently used supplies by implementing a bedside cart in each room. So it provided more efficiency as well as more face time with the patients, and it also contributed to inventory control. So this idea that most likely came from the nurses who were running back and forth from the supply room was implemented, and within a week they noticed that it had a lot of benefits to it, and so now they implemented a system to keep that. Also, the success in the use of this management style in the triage is also reflected in the increase in patient satisfaction and better management by the nurses of the patients, and the decrease in IDI wait times since the implementation of a registration clerk. So the registration clerk took on all the clerical duties that the nurses before were taking on. So, patients were having to wait longer to see the nurses because they were doing the clerical work to get the patients in. But now the nurses are able to focus more on the patients while the clerk does all the clerical work and signs the patients in. So because changes and effects can be seen in a lean management system within 5 days or about a week in comparison to months or years for other processes, it's a lot easier to see if changes within the system are working, and there's a much faster turnover rate to implement new ideas and view the effects of it. So I think that short time span that's used to view changes is something that really lets leadership know what's working within the management system and what's not.